As 2026 approaches, Americans on Medicare and those about to enroll are about to find out the hard way. The program leaves out major health needs like vision, dental care, and hearing, plus a couple of other big gaps most people don't even realize. And the price tag for those gaps, it can easily reach thousands of dollars a year. If you're living on a fixed income, these uncovered costs can make the difference between peace of mind and financial stress. So in this video, we're going to break down the 5 biggest things Medicare still doesn't cover in 2026. And don't forget to watch until the end, because I'll also share some quick 2026 updates. Things like changes to prescription drug costs, vaccines, and insulin that can save you money and help you plan ahead. Number 1, vision care. Let's start with vision. Medicare still doesn't cover routine eye exams, glasses, or contact lenses. The only exception is if you've had cataract surgery. You're allowed one pair of glasses or contacts after the procedure. This means if you just want your yearly eye checkup or you need a new prescription for glasses, Medicare won't pay for it. And these costs add up quickly. A basic eye exam can run anywhere from $100 to $250, and prescription glasses can easily cost several hundred more. If you prefer contacts, that can be another $200 to $300 per year, sometimes higher depending on your needs. Some Medicare Advantage plans include vision benefits, but those are often limited. They might pay a portion of the exam or give you an annual allowance for eyewear, usually capped around $150 to $200. That rarely covers the full price of a new pair of glasses, especially if you need progressive lenses or specialty frames. In 2026, nothing about this changes. Routine eye care remains excluded under original Medicare. Only medically necessary exams, like screenings for glaucoma or diabetic retinopathy, are covered. If vision care is important to you, the only solutions are to shop for an Advantage plan that offers vision benefits or to buy a separate vision insurance policy. Number 2, hearing aids. Now, let's move to hearing. Original Medicare still does not cover hearing aids or the exams needed to fit them. What Medicare will cover are diagnostic tests if your doctor orders them to investigate a hearing or balance problem. But the devices themselves and the fitting process remain your responsibility. This gap can be one of the most expensive. Hearing aids often range between $2,000 and $6,000 per pair. And since most people need 2, that can mean thousands out of pocket every few years because hearing aids typically need to be replaced every 5 to 7 years. There has been progress with over-the-counter hearing aids, which became available in 2022. These can be purchased directly at pharmacies or big box stores, and they are often less expensive, sometimes as low as $800 to $1,000 a pair. That's still not cheap, but it's significantly less than traditional devices. The important point is that even though OTC hearing aids exist, Medicare still doesn't pay for them. Some Advantage plans do offer hearing benefits, but just like vision, those benefits vary widely. Some will cover a few $100s toward a device, while others might offer discounts through specific providers. It's critical to read the plan details before assuming you're covered. Number 3, dental care. Now let's talk about dental care. Medicare does not cover routine dental services. That means cleanings, fillings, extractions, dentures, implants, and root canals all fall outside of original Medicare coverage. The only time Medicare will help is if the dental service is medically necessary as part of another treatment. For example, dental clearance before an organ transplant, dental exams before heart valve replacement, or oral surgery related to certain head and neck cancers. These scenarios are rare, but they have been expanded slightly by CMS in recent years. For most people, though, the everyday dental care we all need, like regular checkups or replacing dentures, remains excluded. The cost for this can be significant. A basic cleaning might cost $100 to $200. A filling can be $150 or more, and a single dental implant can run $3,000 to $5,000. Without coverage, these expenses hit hard, especially for retirees. Some Medicare Advantage plans advertise dental benefits, but again, these usually come with caps. Most plans cover up to $1,000 or $1,500 a year. That may sound helpful, but a couple of crowns or implants can burn through that amount very quickly. So while Advantage dental benefits can help reduce costs, they rarely eliminate them. Number 4, long-term custodial care. This is perhaps the most serious gap, and it's one that surprises many people. Medicare does not cover long-term custodial care. That means if you need ongoing help with activities like bathing, dressing, or eating, or if you need to move into a nursing home or assisted living facility for non-medical reasons, Medicare won't pay for it. What Medicare does cover is short-term skilled nursing care after hospital stay, but even that is limited. Typically, you must have been hospitalized for at least 3 days to qualify, and coverage is capped. Medicare will pay in full for the first 20 days. Then you pay a daily coinsurance from days 21 through 100. After day 100, you're responsible for the full cost. The average cost of a private nursing home room in the U.S. is about $100,000 per year. Assisted living often runs $50,000 or more annually. These costs can quickly wipe out savings, especially for people who need care for multiple years. The only major safety net here is Medicaid, but that requires you to meet strict income and asset limits to qualify. Another option is to plan ahead with long-term care insurance or hybrid life insurance policies that include long-term care riders. But those are best purchased earlier in life when premiums are more affordable. Number 5, annual physicals. Let's clear up a common point of confusion: annual physicals. Medicare does not cover a traditional, full head-to-toe physical exam with routine lab work. What it does cover is a welcome to Medicare visit in your first year and yearly wellness visits after that. These wellness visits are focused on preventive care. They include things like reviewing your medical history, checking vital signs, updating your list of medications, and discussing your risk factors. They are important, but they are not the same as a comprehensive physical. If you ask your doctor for a full physical with blood tests, you may get a bill unless there is a specific medical reason for those tests. This catches many people off guard because they assume annual physical means what they grew up with: blood work, screenings, and a full exam. Under Medicare, unless those services are tied to a diagnosis or risk factor, they aren't covered. That means you need to be very specific when scheduling. If you want a no-cost preventive benefit, make sure to ask for your annual wellness visit. And here's something important. Our list of 5 isn't the whole story. There are also some new changes in 2026 that could save you money and help you plan ahead. First, Medicare Part D will have a higher out-of-pocket cap, $2,100 in 2026, up from $2,000 the year before. The good news is you'll still have the option to spread those costs out with a monthly payment plan instead of paying all at once. Second, every ACIP-recommended adult vaccine remains free under Medicare Part D. That includes shingles, pneumonia, flu shots, and more. And insulin? The $35 monthly cap continues in 2026, which is especially important for those managing diabetes on a limited budget. And third, dental coverage is expanding just a little, but only in very specific medical situations like organ transplants or heart valve surgery. Routine care like cleanings, dentures, and implants is still excluded. And yes, those cheaper over-the-counter hearing aids are still widely available, but Medicare won't cover them. So now I want to hear from you. Which of these uncovered costs in 2026 worries you the most? Is it vision, dental, long-term care, or something else entirely? Drop your thoughts in the comments, because I read every single one and your experiences help others watching too. And if you found this video helpful, hit the like button so more people can see it. And make sure to subscribe for more updates on Medicare, Social Security, and the financial issues that matter most to you.